I'd like to get started with the session and introduce our presenters. We have Michelle Earle-Crane, instructor with Center for Nursing Studies, and Pam Moores, faculty member with Western Regional School of Nursing, Grenfell campus. So I'll turn it over to you both.
Thanks very much, Andrea, and thank you everyone for coming to our session this morning. We're really pleased to present this information to you all. The purpose of the presentation is to discuss the various remote teaching learning methodologies that help facilitate student learning specific to community health nursing practice. And I will also highlight some important lessons that we've learned along the way. We want to share results of a survey that we administered to students upon course completion for the purpose of course evaluation. This information helped us gain further insights in remote delivery and help facilitate for the delivery of other courses this past fall and winter. First, I will give a brief background on the course and share some of our journey from March 2020, over a year ago, with respect to planning and delivery. Michelle will cover the survey results with you, and I will then summarize by sharing highlights, opportunities, and challenges. And as Andrea noted, we'll leave time at the end for questions. But you certainly can, pop them in the chat as you think of them if you'd like to do that. I would also like to acknowledge faculty from all three sites of the Bachelor of Nursing program, Center for Nursing Studies, Western Regional School of Nursing, and Memorial University's Faculty of Nursing. They all worked very actively and were very actively involved in course development and delivery. And I won't shout out the names, but we will have a picture of everyone at the end today so that you'll get to see who was part of our team. So to help set the context for this presentation, I'll cover some of the background briefly. During the community health nursing practicum, nursing students work under the guidance of a community health nurse preceptor. They spend 4 weeks in the community setting, variety of settings, could be a public health nurse, could be a home care nurse, for example. And this course provides students the opportunity to integrate and consolidate knowledge and competencies acquired throughout the program and apply to the lens of community health nurse. So this practicum was offered during the last 4 weeks of the 4-year program for our students in March 2020 at the Center for Nursing Studies and Western Regional School of Nursing. We also offered the course to students in the fast track option at Western Regional School of Nursing and MUN Faculty of Nursing in April. So we had 2 back-to-back runnings of this course. So the pandemic certainly created a period of uncertainty for all our clinical placements. As one can imagine, public health was a big part of this course, and like every other area of nursing, there was certainly a lot of uncertainty, a lot of other competing activities going on, and the placement of, having our students out there was very short-lived, I'll say. They were there for a very short period of time, and we had to look at moving this course to a remote delivery in a very short order, which we'll get into in a bit later. These students were also at the very end of the program for the most part. They were in their last 4 weeks. So they had a lot of knowledge, that they built on for this course, but they were very anxious to graduate. The province was very anxious to have more RNs in the healthcare system as well. So that gave us a lot of motivation to, get the work done and develop this course. So we had 106 students in the first running with the Center for Nursing Studies and Western Regional School of Nursing. And then we had 36 in the fast track option. So we had a lot of students. Students were very stressed at the time. They were concerned about the pandemic like we all were. There was a lot of uncertainty. They wondered if they were going to graduate. They were worried what the clinical would look like. They were, fearful of getting sick, for example, out in the clinical setting. So they had a lot of information coming at them. So we certainly, as we were developing the course, we spent a lot of time on conference calls with them, debriefing, trying to keep them in the loop as we were moving along for their coursework. And as noted, within a short time frame, course leaders and faculty collaborated and developed a plan for alternate remote delivery. We'll speak more to this later, but it demonstrated the amount of work that we were able to pull together in a short period of time, and we had a phenomenal group of of team members. So that certainly helped us. And it helped our students complete the course successfully and meet graduation requirements. So I'm going to give you a little information about the topics that we've covered. I won't go into a large amount of detail with it because, again, that would be another full presentation in of itself. But I want to give you some information just to help set the context, just so that you understand some of the questions and responses to the survey that we had administered to the students. So course objectives were reviewed, and the alternate delivery was organized based on the following topics, as you see here. During orientation, students were given an overview in addition to a detailed course schedule. Students moved through the course with each topic spanning multiple days. So we encourage students to move through the course as it was in the plan. However, they were given the opportunity to, do some things within their own time frames. But for the most part, we had information building on one another, so we encourage them to follow along. Plus, it was very helpful to be on the same time frame and page as their peers as well. So much of the assigned work was used using the Canadian Community Health Nursing Professional Practice Model and Standards of Practice. So this is a guide and guiding tool and document that provides guidance to community nurses in their practice, and it helps set the standards of care. So we use that a lot for some of the work that we help deliver. So I'll speak a little bit now to each of these topics. So the first is the role of community health nurse. So students have already completed a theory course in community nursing in second year. Plus they had 2 other courses in practice, community health nursing practice. So they had some knowledge. So we didn't need to start from the beginning. We were able to build on, the knowledge that we're given. So we, worked here to gather a lot of webinars, videos, things that they could look at themselves for the first day or so, just to kind of set the stage for what was to follow. So we used organizations such as Canadian Public Health Association, the Canadian Nurses Association, Community Health Nurses of Canada, as well as Canadian Association for Schools of Nursing to help guide us with selecting webinars that were available on their website. So we had a lot of, searching through online information that was accessible for the students. So students were asked to develop and deliver a group presentation as well. So that would fit under the role of community health nurse. So they were asked in groups to choose an aggregate to work with, which would be like a school-age child, an older adult population, and develop a presentation around a health promotion session and deliver it at the end of the course. So that was taking on the role, one of the roles of a community health nurse, and that was an example of group work that we asked students to do. We spent a great deal of time on COVID-19, as you could imagine. There was so much to learn at that time. We were not only interested in the impact to the healthcare system and the population of Newfoundland, of Canada, of the world, but we were also very interested in the implications for community health nursing practice. So we spent 4 days of a variety of experiences. We had self-paced learning modules from the World Health Organization made available to them. They did disease surveillance following number of cases, number of deaths, hospitalization. So they did a lot of work around that, for the country. They compared what countries were doing around protection and mitigation. So they might have chosen two countries in the world and made comparisons of how countries were working differently and how countries were working similarly around this. We had guest speakers. We had Dr. Donna Morileo, who has expertise in immunology and epidemiology, speak to our students, provided an excellent presentation and a great overview and a lot of good information for all of us. So there were a variety of group activities, individual activities that certainly helped reinforce the roles of community nurses with respect to contact tracing, just all the work that's being done behind the scenes for protecting our population. And then we looked at community supports and continuing care nurses. And this is an area where nurses generally go to people's homes and provide nursing care. So home nursing care often. is the case may be. So we had, again, a lot of, we had some guest speakers to come and speak and share some of their experiences, but we also had case studies that were developed to get students thinking about, the role again of the community health nurse in someone's home. We also were lucky and very fortunate to have students participate in a wound care conference virtually that was offered. We had, permission from the actual organizers for free admission for our students, which was phenomenal. And there were limited numbers, so those who could not attend the online, the virtual one, they were able to view recorded versions as well. So this was something that was, really wonderful that, students would not have gotten an opportunity to do. And then in public health nursing, we also highlighted areas that were significant. For example, immunizations. Students got to complete an online program, a course on that. They also had worksheets. We had activities for them. There was postnatal virtual simulation. There was a well baby simulation. They were also able to do a course, 4-hour course on postpartum depression, which was really key and important. And we had a number of activities on breastfeeding as well, which is, a very important part of public health nursing. For Indigenous health, we had activities that were used to look at cultural safety and humility. And so students were asked to do discussion posts that help share their thoughts and views around some research that they did, and also some clinical experiences that they've had to date. And this really initiated some really interesting conversations. For mental health, we had virtual simulation, community home visit, and this was around partner violence. Again, really important piece, and it really showed how working in someone's home was quite different than working in an acute care setting. So in addition to that, we had a number of other activities, but like I said, I just wanted to go through some just to give you a sense of what we had covered. But it's also very important to understand what learning opportunities we provided, to give, again, a context for the survey that Michelle's going to talk about. When I first look at this list, though, right now, the knowledge and little more comfort level that I have with some of this technology, I feel a little more comfortable. But looking back in March 2020 at how we were going to deliver all these course offerings, activities using technology, it frightened me because I, personally felt intimidated by a lot of technology. But like I said, that we have certainly gone a long way in our year, and now, yeah, in perspective, it's much more tolerable and doable for us all. So some of the big pieces I guess we want to look at is the webinars and videos gave students some flexibility so that they didn't have to sit down all at one time and view the webinar because there were competing demands on students' lives. Some had children and other responsibilities, especially with pandemic going on. There were changes and lots of things happening in their lives. So it gave some flexibility, even though we did encourage them to try to stick to the day if at all possible, but the time may have been different. Everything we looked for and found was free of charge, so there were no costs to the students to do that, other than their time and their commitment. And students were very, very motivated to do this, I must say. We used Brightspace online rooms, and we used PowerPoints, we had polling, we had questions with scenarios, anything that could foster application and engage the students, in discussion was really key. And we had that frequently throughout the period of time. We also had discussion forums. Again, they were up for so many days that students could participate in, a back and forth discussion. Again, some very interesting and engaging discussions there. And for case studies, we offered small group and we offered them in small groups, I should say, and they were developed and adapted by faculty. So we tried to make them as real to true scenarios as possible. And it's important to point out that some of the case studies were completed in a variety of ways. Some we facilitated through our online room discussion, while others required discussion posts with faculty and students responding to each other's posts. And then there were others that they would actually just do the write-up and submit to Dropbox. So there were different ways. So when you listen to Michelle's discussion around that piece around case studies, that will give you a little bit of context for that. We had group and individual assignments throughout, through all the different topics, which, helped students work together, but also gave some the flexibility of working on their own. We had the virtual conference, which was the web wound care conference, which was really wonderful to have, and variety of guest speakers who provided some really good information for us, and students really enjoyed a lot of that. And then finally, virtual simulations. So that was really key, I guess, in having students do this, and it provided the information, kind of like put them in a setting, rather than just talking about it. They were able to actually be part of it virtually, which gave them more of an opportunity. And since this past year, this is something that certainly has been increased in our nursing education. Virtual simulations have certainly increased. There's a lot out there now, a lot more than it used to be. And so I think we will continue to work with those particular types of learning opportunities in the future for sure. And now I'm going to pass it over to Michelle.
Okay, thank you, Pam. And, great job in setting the context of where we went from in terms of developing then the course evaluation survey. So because this was our first time offering this particular, remote delivery option, we really wanted to hear from students what was effective, what helped your learning, what do we need to know to build further simulation if in fact we had to offer this again. At this point in time last March, we really didn't know what we were facing, and so we really counted on the students, I guess, to give us that feedback. So we did, Pam and I developed a survey which was comprised of 10 quantitative Likert type scale statements with 2 qualitative statements. And as Pam said, in total, we had 142 students complete the alternate delivery. We had 97 students participate in the survey, which gave us a 68.3% response rate, which we were thrilled with this level of engagement. And it was the same level of engagement that we had from the very beginning. I am going to highlight as we go through the survey some learning activities that we incorporated based on student feedback. So when we started developing this as faculty, we did send an email, course leaders sent an email to the students and asked them, what types of learning were you expecting? What types of learning, were you looking forward to? What types of learning do you need in this course? Again, these were fourth-year students ready, this is their last course before graduation. And so we really wanted their feedback, and we tried to incorporate that into the learning activities of the course. And I will highlight that wound care was one thing that came up repeatedly, that students wanted more with regards to wound care. And so we were thrilled that we were able to offer that virtual conference for them. We used Qualtrics as that was the preferred platform of Memorial University for survey construction, distribution, and analysis. The Likert scale was a 4-point Likert scale, so just keeping in mind as we're going through the questions that 1 indicated strongly disagree and 4 indicated strongly agree. And of course, the 2 open-ended qualitative questions. So the first statement was, online course components were clearly stated. And as you can see here, we had a very positive results here in this statement, and you'll see as we move through the evaluation that we had very positive results throughout. And I think it is reflective of the time and dedication of faculty during course development and delivery, and that every effort was made to optimize student learning. Here you can see that 89 students, or 91%, agreed or strongly disagreed with this statement. The second statement, online activities were engaging and provided opportunity for learning. Here you can see that 92 students, or 95%, again, agreed or strongly agreed with this statement, with only 5 students disagreeing. So I think that really, you know, stands to the learning opportunities and the level of engagement that the students had during the course. Statement 3, I have a better understanding of the diverse role of community health nurses. And this was really important for us because faculty identified this as an opportunity during this type of alternate remote delivery. Often when students go out to do their clinical practicum, they're assigned to a public health nurse, or they're assigned to the, a continuing support program, so a community health nurse within continuing support, two very different areas of community health nursing. And so we aim to provide students with learning from both areas of focus, and by doing that, enhancing their overall role of the community health nurse. So here you can see that 90 students, or 93%, agreed or strongly agreed with this statement. So we were really happy about this when we saw the response to this particular statement. Number 4, this course helped me apply key concepts for community health nursing practice. While this method of delivery was certainly not intended or ever is intended to replace, a clinical practicum, it was important that the application of concepts and principles be an important part of the learning of this remote delivery. Remembering that students were required to meet specific course objectives and entry to level nursing competencies, that were required based on our regulatory body of the CRNNL. Here you can see that 92% of students agreed or strongly agreed, and we only had 7 students who disagreed with this statement. Statement 5, course instructors were available to answer my questions. And I want to really highlight this as a belief of our team that the engagement of students is reflective of the engagement of our instructors and faculty. And very key to remote delivery is the availability of faculty during this remote delivery option. You can see there that 100%, so all of the students either agreed or strongly agreed with this statement, with 82% strongly agreeing. And this was phenomenal for us. The coordination that was involved, as Pam reflected on, for us at that point in time, technology was new, and all of these simulations, the virtual discussions was all new to us, polling and breakout rooms and all of that that we were incorporating was new. And so we put a lot of time into building the course so that it would enhance student learning, and also being there on the other end to facilitate students when they were having difficulty. Some of the virtual simulations, students were required to set up accounts with passwords. While it was free, they still needed some help navigating. Remembering too that this is the first time that these students were having to navigate, these additional websites. And so, a huge amount of coordination, frequent emails to provide direction, and to motivate students, to keep them motivated. The frequent feedback, whether it be discussion postings, whether it be assignments, whether it be during times when they were working on group work, to be there to motivate them, to provide them with the feedback that they really needed, for their learning. And so this, is key, and Pam is going to speak to it again as we bring out our key highlights from this presentation. So statement 6, webinars stimulated my interest in the topic and promoted learning of course content. 96 students responded to this, and while we had 80% agree or strongly agree, we did have 20% disagree or strongly disagree with this statement. And so I want you to think about webinars, as being probably the least engaging that of the different learning situations that we provided to students. So that the student, it wasn't interactive for the student. And we're going to talk a little bit about that again as we look at the qualitative comments. Statement 7, virtual simulation activities stimulated my interest in the topic and promoted learning of course content. Here you can see that virtual simulation, again, perhaps one of the most engaging, was quite impactful to student learning. Students were engaged in these activities. We had 89% agree or strongly agree with this statement. And again, I'm going to provide a little bit more insight through our qualitative data when we get to that. So really comparing those two where we are the least engaged to the most engaged. Number 7, also a very important component of our course delivery. Virtual synchronous group discussion through online rooms stimulated my interest in the topic and promoted learning of course content. This was important, as you can see that 95% of students agreed or strongly agreed with this statement. We're also going to talk about this again when we get to the qualitative responses. Students wanted time to debrief about their learning. They wanted to discuss what they were reflecting on, whether it be the case study, whether it was bringing literature through the case studies, and they were quite engaged in our synchronous debriefing sessions that were held through online rooms. We really didn't anticipate this, and it was something that when we were developing the course that we struggled with as course leaders, as faculty, to how much was enough, how much is too much in a remote delivery option of this course. And while we look to the literature and, the literature is telling us that, you need to debrief. When you're doing simulated activities, you need to have synchronous debriefing. But how much synchronous debriefing, how much was going to be enough, how much was too much, is something that we struggled with. And so we really look to the students to give us some feedback here. And I guess anecdotally living through the experience, we saw how engaged the students were when they were coming to their synchronous online rooms. We had an average of 3 2-hour online room sessions each week of synchronous discussions, just to put it into, in terms of the number of hours. And looking forward, to when we looked at, having to develop this course and offer this course again, and I'll speak to that in a moment, we looked at increasing that synchronous discussion opportunities. So number 9, guest presentations stimulated my interest in the topic and promoted learning of course content. Overall, students enjoyed the guest speaker presentations and discussions, and they really brought the experts to the classroom. And so we were really grateful that during a pandemic that we were able to reach out to some of our experts in the field of community health nursing, or whether it would be epidemiology, whether it was palliative care, whether it was mental health, that we were able to incorporate some of this into their learning. However, while we see here that we got very positive feedback quantitatively, these guest speaker presentations were not reflected in the top 3 activities identified by students in our qualitative comments. So we'll speak to that again in a moment. And the last Likert type question that we or statement that students responded to was that case-based discussion forums through Brightspace stimulated my interest in the topic and promoted learning of course content. So although 85% agreed with this statement, a previous slide showed 95% agreed that synchronous discussion facilitated learning. So again, Pam did bring this out earlier, that case-based discussion was done in 2 ways. It was done synchronously and it was done asynchronously. Our synchronous online room discussions were either case-based discussions or they were debriefings from simulations. Students also were presented with case-based learning through discussion postings through Brightspace, which was asynchronous. They were, again, discussing based on a case. So I think that when we reflected and we looked at this data, we can see, again, very clearly that students preferred the synchronous discussion as opposed to asynchronous discussion of these case-based studies, case-based learning. And these case studies, again, as Pam noted, were as close to practice as we could get them. You know, we really tried to bring in our knowledge and bring the clinical decision making, you know, the ethical decision making that happens when we're providing care in the community. And I think students really, I guess it validated their experiences when they could share how they would respond to a particular scenario, and hearing how other students would respond. We move next into our 2 broad qualitative statements that we asked students to reflect on. The first was, one activity I found most helpful was, and we're going to provide some verbatim feedback from students, which is quite powerful. But first, I'd like you to have a look at this pie chart. And I know there's a lot of components here within the pie chart. Feedback was grouped to provide a quantitative sort of context here. So items that you see starred reflect categories in which verbatim quotes included more than one category. So students identified more than one learning activity that they found most helpful. So they might have, discussed the wound care conference and also guest speaker presentations, just for an example. So that's where we're getting, you're getting those stars there. So this is certainly not an exhaustive list of all the activities. Instead, it's the activities that students identified as most helpful without being prompted in any way. It allows us to see that the 4 top activities that students found helpful for learning were virtual simulation and games. So probably our most engaging, the most interactive. The Wound Care WoundCon conference, which was something we incorporated based on the responses that we received from students, that learning that they felt they really needed at this point in time. And online discussion, classroom, and case studies. And again, remembering that the online room discussions were centered around debriefing of simulations that they were completing and case-based, case-based learning. I'm going to provide you some supportive data here now, and quite powerful. There was many statements to choose from, but of course, with the time, we can't share everything, but we picked the ones that we thought really brought out, overall what the students were bringing to us. One student states, I really enjoyed the simulations where you pick the answer, then a video played regardless of if you were wrong or right, and you got a reaction from the patient if you were wrong. I felt I learned a lot about communication doing these. So again, the student was engaging in the activity, and then they were getting feedback back, which was really important. The second quote here really highlights the engagement in learning and the application of community health nursing principles. So one student stated, I enjoyed the online modules and games where we had to take on the role of the community health nurse and choose the correct answers. I found that these simulations helped me like I was actually filling the role of a community health nurse and felt like I could put my knowledge to practice. So again, very clearly putting them into that clinical role through a simulated experience. The simulation activities were awesome. They gave rationales that the answer chosen was wrong. It felt like I was out in the community practicing as a public community health nurse. Okay, so again, that simulated activity, bringing them virtually into those roles. Another student stated, all activities were great in enhancing learning. The WoundCon conference was amazing. So much information to carry into my practice, really helpful. Another student stated wound care webinars because this was an area that I didn't feel comfortable with. So while students could attend the WoundCon conference, at that time they were having difficulty with bandwidth and couldn't take all of our students, but there were recorded webinars that the students could access, and the students were able to actually access the recorded conference some days later. So again, this was wound care was an area that students identified for learning for Nursing 4512, and so we were able to, seek out this WoundCon conference and other resources that we provided to students for wound care and to meet their learning needs that they were identifying before the course started. Other students stated case studies followed by discussions. So again, that synchronous debriefing, class discussions through online rooms and virtual simulations. And another student stated the virtual simulation activities, guest speakers, and the synchronous group discussions through online rooms. So here you can see that need for synchronous debriefing coming out very strongly in our data. And then the last statement on our survey was the second of two qualitative statements. And we asked the students to reflect on one activity I found least helpful was. So again, I'm going to ask you to look at the pie chart here, and you can identify that webinars were the least effective learning activity. So the webinars were not only the wound care webinars. I know we focused on those because we got positive feedback based on that, but we did have other webinars included throughout the topics that Pam has already discussed. So again, the least engaging, I guess, opportunity for student learning, and it was the least effective learning activity. You can see there that 30% of students identified webinars as being the least effective. I want to highlight here the orange part of that pie chart. Students, 16.3% of students stated none. So giving us feedback that all of the learning that they did, they felt, was important to meeting the course objectives and was effective in meeting their personal learning that they needed for this course and for this point in time prior to graduation. 8.8% did highlight case studies, and so therefore, as many students found the online rooms most helpful, and knowing that case study discussion was facilitated in this way, it lends itself to the interpretation that, other methods of case study facilitation were not as effective as the synchronous online rooms for case study discussion. And just giving you some supporting data, again, some verbatim quotes from students. Long webinars were sometimes too long and boring from presenters that were not engaging. Another student stated there were several webinars that were very repetitive of previous community courses and did not build on knowledge, but rather were repetitive. So again, importance there of highlighting, what's happening within your curriculum and what's happening within other courses so that you ensure that you're building on their previous knowledge. MAID was one area that was highlighted throughout the data as being repetitive, and this was something that was had been incorporated throughout the curriculum because it was seen as something that was fairly new within nursing practice, and something that we really felt that students needed to talk about and needed to be enhanced in terms of from a palliative care perspective, and certainly what was happening out in the community. But MAID was one area that was highlighted as being repetitive. Another student stated, I found the student presentations were a nice idea. However, it was fairly difficult to organize. It was harder to complete group work through communicating online rather than being able to meet in person. So I just want to remind you that this data was collected following the March 2020 remote delivery of this course. And, students at that point in time were engaging in group work by meeting in person, and they were in class together. So this was the first time that they really had to negotiate that and collaborate that in a virtual context. And so this remote delivery was revised based on student feedback, and it was necessary to repeat this alternate remote delivery for the March 2021 student cohort at one of our sites because of the impact of the pandemic, within our communities at that point in time. And so we did, again, complete an evaluation, and we don't have that data yet, but the students just completed that course offering. And it will be very interesting to see whether or not students found this collaboration difficult now, a year later, when they have been remote now and learning remotely through their courses over the past year. So it will be interesting to compare those two course offerings. And another student said, I found all activities in this course to be helpful in one way or another. There were no activities that I disliked. And this again, stated by another student, I felt that all components were beneficial, purposeful to meet the objectives of Nursing 4512. So 16%, 16.3% of students answered none to that statement of what was the least impactful learning during this course. So I think that really speaks volumes to the learning outcomes of this particular course delivery. So that's the end of the survey data. So now I'm going to go back to Pam, and she's going to pull out now the highlights that we want to leave with you, the challenges of remote delivery and the opportunities that this type of remote alternate, learning, I guess, provided us, and within nursing.
Thanks, Michelle. Yeah, so basically what we did now for the next few slides, we just highlighted some key points. Michelle spoke to them quite in-depthly, so I won't take up much time. So we should wrap up in plenty of time to have questions at the end. So students were most engaged with interactive learning. Again, that came out loud and clear. They wanted interaction, and certainly the simulation games were number one on their list. Case studies that included the synchronous online room debriefing were preferred versus the asynchronous discussion posting of feedback. And Michelle talked, a lot about that. And we had some really, really good discussions, I have to say. And even the first few times we were on online rooms together, people didn't want to put their cameras on, even mics, they were, chatting in the chat box rather than talking, which we still encounter with students nowadays. But at that time, it took a little bit of time for them to start coming on and having more, conversations. But we have to remember, we had large numbers of students too. So the ability to have cameras in the first offering was harder. The second offering, I had fast track options. So I had smaller group numbers, so I was able to use cameras more then. And I was more comfortable in the second offering, of course. Wound care came out as a key topic identified, which, was wonderful that we could certainly provide that to them. Guest speakers provided current knowledge, yes, and many were experts in their fields. So we drew on who we could find that was available, and they were all very relevant to community health nursing. Webinars were least helpful for learning, and leveling of topics based on previous learning. Again, we have to be mindful of that, what they know, and build on. So I can certainly understand some of the webinars, especially at the first day, may have just repeated some of the information. But I always tell students, when you repeat it, that means it's really important as well. So then, of course, strategies to avoid repetition is something that we're going to take with us in the further offerings of this course in all capacities. So we were faced with some challenges, but also with many opportunities. So time, first of all, I guess I'd like to say, can you replace the clinical experience with this type of course offering? Absolutely not. And we were very clear with the students. We were very clear with administration. We're not replacing, we're augmenting what information they have through remote learning and the application of principles. So I think we achieved this based on our feedback from our students. And I think, as a faculty, we all felt that we did a good job at the end of the day, which was important. But, time certainly was our enemy at the beginning. We had very short time frame to produce this course. So luckily we had a lot of people working on this, but we were running against time to deliver on students, to make sure that the information was there for them. And there was time delivering the course as well. Students had a lot of time commitments with attending, doing the assignments, but we had a lot of time commitments doing the engaging and correcting, because typically they will be out with their preceptor in the community. So some of the work that we would do with them was not so much interactive. So we spent a lot more time engaging the students. So certainly that stepped up quite a bit. Technology, again, we could speak a lot about that. Broken links, videos won't work, my password won't work. I can't get on Brightspace. My bandwidth is not working, because these students are all over Newfoundland and Labrador, and some even in other provinces. We're doing this course because they may have traveled to another area to actually complete the community course, in their home community. So they were all over the place. So we certainly counted on, our IT people, our CITL people for sure, and in both Grenfell and Munn campus certainly were very beneficial and helpful to us. I learned a lot. I can't imagine. I thought I was at the end of my learning because I'm at the end of my career, but nope, a lot more to learn for sure. Certainly, I think having the the presentations all in one online room was probably one of the biggest challenges that we faced. We had our students at the center and also at Worsen all in one online room, which was 100 plus. And remember, at that time, you couldn't have more, or you shouldn't have had more than a certain number. I think it might have been 50 or 75. So sometimes we ran into trouble there. So we had to, use telephones. People would call in. We even did that with the speaker one time when the mic wouldn't work. So we improvised, again, learned as we were going along. Using drop boxes was phenomenal. That cut down on a lot of our emails because we had so many assignments that were due. And typically, yes, we use those in our courses, but we didn't see the value of it until we had the number of assignments that we did in this particular course, for sure. Let me see. What else do I want to talk about? Around communication, again, go back to collaboration. So it was faculty to faculty, and it was faculty to presenters, it was faculty to students, students to students, and then faculty to IT and tech support. So it was a lot of back and forth collaboration. And, our faculty had a diverse amount of expertise in community and nursing in general. So we pulled on whatever anyone had in their past experiences. This is what you did. I had a few years under my belt in public health, so I went off doing those things. Michelle had a lot of experience in pediatrics. There were many nurses who had wound care experiences, med-surg, so it went on and on. So we pulled in what we could at the time, and it worked well. Communication was key, and I'd say, in air quotes, we were present, and that was, I think, the most important part. Students knew that they could count on us, and we spent a long into the night sometimes, helping students and working with one another in our groups. But being present was the key. They knew that they could count on us and get us fairly quickly if they needed us, if they were trying to do something or had questions. So we were at the end of their email or the camera whenever possible. Enhanced learning of diverse roles of community health nursing. Definitely a key component here. I think we certainly looked at, what resources were available and utilizing to the fullest, for sure. And I think, our curriculum now is moving from a 4-week community practicum to a 6-week community practicum. And some of our learning opportunities that we have availed of in this course will be carried over and used again. And I think that's a very good benefit and an opportunity for this. And we've learned the importance of leveling and the repetition that Michelle talked about that the students responded to as well. That's something that we really need to look at as we revise the course. So in summary, connectedness with faculty was certainly the key factor. We feel that students certainly had a heightened engagement, with their application of knowledge through the interactive piece of it. So it's all about the interactiveness. And another highlight was the commitment of faculty that provide a unique and diverse learning opportunity for students to be successful in achieving course objectives. And I think we did do it. So we would like to acknowledge Dr. Pamela Ward, Research Coordinator at the Faculty Center for Nursing Studies, and Kara Caravan, Research Assistant at the center as well. They both, Kara was instrumental in collating the data, providing the graphs and pie charts for us, and they were both very involved in creating the survey within the Qualtrics platform, the collation and data analysis. So they certainly helped myself and Michelle pull all this together. So we thank them for that. And this is our team. And I just want to note that we were actually nominated by Dr. Sandra McDonald, Associate Dean Undergraduate Programs at Memorial University Faculty of Nursing. And the nomination was supported by Dr. Sue-Ann Manville-Anstey, Associate Director at the Center for Nursing Studies. And we were finalists, so we were really proud and pleased that we were acknowledged in this way. But this gives you a nice picture of the faculty. We do have one person missing, Marlene Brown, who's retired at this time. But the expertise in this group certainly was something that a strength for us as we move forward with this course delivery. And that's it from my end. I don't know if Michelle, you have any other comments to make. I'm looking at the time. It's 11 o'clock, right on the nose. I wonder, is there any questions that we could spend 20 seconds to to actually answer. Are there any questions?
I just had one quick question. Thank you both for that presentation. That was really interesting, and I can imagine, how quickly you must have had to pull a lot of this together. Especially when you think about nursing and some of the other healthcare fields, doing these practicums in person and then having to shift is really amazing. And knowing that the feedback was positive. Just wondering about the licensing exam. Were there any issues? I know you mentioned earlier about making sure you're meeting the course objectives. So in terms of the students and licensing, were there any challenges? And did you have an opportunity to look at students who graduated in previous years under normal circumstances, how that compared in terms of their scores on the licensing exams?
I know from our end, because we have, we are one collaborative program, but we do have our own groupings. So we had not seen any differences in the numbers. I don't think so. I even actually remember some students saying that they felt they were better prepared in community because they had such a big, diverse amount rather than just going with one focused area. I do remember students saying that, anecdotally at the end, afterwards, saying that they felt that they could answer the questions and they did, find that more comforting when they were studying for it. But I don't think there were any differences. Michelle, I don't know if you can comment on from your end.
No, and I don't have the specific pass rates, but there was the pass rates have been very high for students coming out of the Moore University, the collaborative program from the 3 sites. The province of Newfoundland, students from this province have one of the highest scores in the NCLEX exam. So we're very proud of that. And we've held that. We'll see what this year brings with all of the remote delivery gone for 1 year. So I think at the end, I think this year it will be certainly something to look at. Whereas at this point in time, it was only this one particular course last year that was remote. We were sort of the start of what are we going to do now to try to facilitate clinical placements for these students and to keep them on track for graduation. So this particular cohort had everything except this course,
Right.
as the other students had.
Well, I think
Great question though, and I'm sure we'll be looking at that this year.
Yes, for sure.
Absolutely.
Just one final comment I'll just make. I think the pandemic gave us all a better understanding of the diverse roles of the community health nurse, for sure.
Absolutely. Absolutely.
Yeah, a great appreciation and hats off, to those nurses, to all nurses, but definitely an appreciation for sure.
Thanks again for giving us the opportunity. We really appreciate that. All the best, everyone, and thank you for attending.